Just in case you didn't know, you were rocking with the Influ Game right now.
Hello, ladies and gentlemen. You already know what time it is. Your boy Belt. Thank y'all for tuning in, subscribing, watching, sharing, liking, commenting, the whole nine. But as y'all can see right now in the screens, I have the cool guys with me today, and I'm gonna allow them to introduce themselves. We're gonna start to my left, which might be y'all right.
So representing the millennials, my name is Vernon Rayford. You may know me as Dr. Rayford. I'm a physician, member of the community. I'm a member of Project Elect, as well as the Northeast Mississippi Coalition Against COVID-19.
Yeah, my name is Robert Hall. I am the chairman of Project Elect. Those of you who may not know what that is, enthusiastic leaders engaged in the changing times. Just a person that's concerned about the community, just a person that's interested in the community, and awesome to be on this influential podcast with my boy, Roosevelt Ford. This is awesome. Yeah.
Hey, man, I thank y'all for being here.
We're excited.
Oh, okay. I'm glad. What's called? There was my guys to the audience. My guys are asking, was I nervous? I said, no. I said, I do this. All right, man. So we're going to touch on, which is very important. This month, I think within this month, it's a lot that's going on. But today, since we got the cool guys in the house and happen to have a doctor, we're going to discuss strokes, high blood pressure, and mental health. And I know for those that's been watching and whatnot, like if you've been watching shows or any type of show where you got a doctor, you only got so much. But we're finna dive right into it. All right, Doc.
Yeah. So I'll start off by saying that each of those topics can take up lots and lots of podcasts. So you can have your whole podcast around one of those topics. And so what I'm going to do is just give a big high level talk about it and answer this question is, why should you want to know more? So as things go, each month there are typically some health observances, and those observances are made to recognize certain disease states or conditions that affect the population. So May, we happen to have a really loaded month: high blood pressure, stroke, and mental health.
Yeah.
There are other months where mental health of different subgroups, Minority Mental Health Month, but May is the mental health month. And so what I want to do is just kind of give a high level talk about, and not necessarily a talk, because we're talking. And for those who have kind of heard my voice before, you've heard my voice, you heard or seen us on Facebook Live, Project Elect's Facebook Live doing COVID conversations. Yeah. So Mr. Hall and I, we've kind of come together and we've talked about COVID and things like that. And now as we're transitioning to a different aspect of COVID, so the full alarm, all kind of caution, public health emergency of COVID, that's gone. Yeah. COVID's still around. And so what we are now doing is we're looking at those things that were here before COVID, those things that got worse with COVID. And that brings us to high blood pressure and stroke. And so one thing you're going to have to do, Vel, is you have to keep me from talking too much.
Oh, no. That's
so you're going to have to jump in.
I was going to catch it. I will catch one of for me, and I'm assuming other people, when you talk about high blood pressure, first thing I think about is pork. But I know it's probably all kind of things that probably cause.
Yeah, that's a very common perception in the community, is that high blood pressure is related to pork. Yeah. It's more related to sodium. And so if you put a lot of salt in your chicken, or your chicken is highly processed, or the turkey is highly processed, it's just as bad as the highly processed pork. And I think where people kind of get it mixed up is the two ways that many people enjoy pork. Yeah. Bacon and ham. Yeah. And those are very processed, very high salt containing foods. Yeah. And so that's pretty much what maybe people are thinking about. But if you raised a pig, you killed a pig, and then you prepared the food and didn't put any salt in it, that pork doesn't have any salt.
Mr. Hall, you ever
in defense of ham, Mr. Hall, you like ham?
Have you put down? Do you watch completely what you eat? Like, how's your blood pressure?
Yeah, I do not, and that's the reason that this is so important to me. Number one is I think I'm on, for myself, keep it real, Doc. African American, more so, I being a black man in my 50s.
Yeah.
I went for an annual physical just
He's
a
a
couple
baby
weeks ago.
boomer, if you wanted to know.
Yeah.
Yeah, and so I didn't like what the doctor told me. Pretty much, he said, if you don't get your blood pressure under control, we're going to put you on a pill. But here's what you got to do for the next 10 weeks. On top of that, personally, and I don't know if any of our audience have that.
Yeah.
I want to be open and real. I have two brothers that's dead of strokes and a dad that's dead of strokes. That's pretty alarming. So how do we, I guess I'm asking the doc, I'm doing all those things I ain't supposed to do, Roosevelt.
Oh yeah.
That's the salt, that's the fish, the burgers.
Yeah.
So how do we start to change for the better?
Yeah, let's talk about it. So, we talk about it, and I think, Mr. Hall brought up that experience about his dad and brothers who died of stroke. How is that connected to blood pressure? So high blood pressure is one of the biggest modifiable, which means we can make it better,
Right.
risk factors for stroke. And so when we're talking about stroke, we're talking, on one hand, we're talking about, big thing is preventing it.
Yeah.
Knowing your blood pressure, knowing what you need to do to make it better, and keeping it good.
Question. So, can you have a stroke without having high blood pressure?
Of course you can.
Oh.
You can have other.
That was a
You
good
can
question,
have
wasn't it?
other. Yes, sir. You can
Man.
have other things that increase your risk of stroke. And so, if we were to list them out, so high blood pressure, smoking, unhealthy alcohol use,
Okay.
being heavier than normal. Now, all those risk factors tend to interact together. Some people have certain things like sickle cell disease. So people
Okay.
with sickle cell disease have a higher risk of strokes.
Right.
Some people have kind of strong family histories, and it's more related to cholesterol.
Yeah.
That they can have a high risk of stroke. And so it's more of those things. And when we think about all of those modifiable risk factors, we think that about 80% of strokes and heart attacks can be prevented. And so you think about the numbers that we're seeing. I think if you're in the audience and I say, hey, do you know somebody who's had a stroke? Every hand is going up. And I get closer. Do you know someone in your family who's had a stroke? Every hand goes up. And then it may get even closer. Have you had a stroke or a stroke scare in the past? And you'll see a lot of hands stay up. And I think it's so common, it's so prevalent. Sometimes it feels like it's just going to happen. And that's
Yeah.
the wrong way to think about it, because there's so much that we can be doing in terms of those things we know we can do to prevent it.
You are now rocking with Influ Game.
Real quick. So I know you was listing off like the being overweight. It could also be smoking, drinking. Now, when you named about 4 or 5, do the list continue or does?
Yeah.
Oh man.
Now there's some
that's good.
other things that are certainly less common. There's some other things that are certainly less common there. When you just think about, our understanding of stroke risk factors is that there's a list and not as many folks. But what's important is if you're doing the big things on the list, you're making your stroke risk even higher. Certain medicines and certain women who are on like different hormone type things, different hormone type combinations can be associated with stroke. Certain procedures like radiation to the brain, if you've ever had any need for radiation to the brain, that enhances your risk of stroke kind of after that. But by far and large, if you had to top 5 it, blood pressure, smoking, alcohol, nutrition, exercise.
Okay.
And
So,
stress.
Yeah.
golly. So I got a question with that.
Oh, yeah.
And this is
Go ahead.
going to be probably, how old are you?
I'm 34. I just
Okay,
turned
I'm 56.
I think he's the generation after millennials, whatever they call them folks.
So my question is,
Gen Zers.
okay, between the 34-year-old and the 56-year-old, what are the ages that's most prevalent for the strokes?
So-
People think it's old people.
Yeah, so certainly the older you are, age can be a risk factor. And the older you are, you certainly have a risk factor. What we're actually seeing in different communities, if we think about African American communities, especially with family histories of high blood pressure and high cholesterol and stroke, and I forgot to mention diabetes.
Oh.
And diabetes, having that cluster of risk factors that run in your family mean that in your 20s and 30s, if you're not getting a handle on the problems that you do have at that point, that you have the 20, 30-year-old, I still feel good, therefore I am good.
Yeah.
And a lot of 20-year-olds and 30-year-olds are surprised by their strokes, surprised by their heart attacks. And so that's an instance where families need to communicate to each other. You know, when Mr. Hall talked about his family, that's an important lesson for him and his family, because he knows where the risk clusters. He knows what he has a risk for, which means he needs to modify those a whole lot. You know, he needs to modify those things, even and especially at a point where you don't feel bad. So with blood pressure, you don't feel bad until you do. And unfortunately, if you wait all those years, those decades to feel bad, there's a chance you won't feel good again.
So the black man, and you help me with this because I don't want to be the old one hanging out here.
No.
So when he mentions high blood pressure, I've heard so many men say, I'm not messing with that medicine. I'm not doing anything because it's going to mess with me in a lot of ways that men don't want to be messed with.
Oh.
Yeah, so Robert's beating around the bush. Okay. So, you know, Robert's talking about something that commonly happens. It's something that's common that happens that in the different communities, especially, I mean, you know, we're thinking about barbershop talk. We're talking about barbershop, basketball court kind of talk.
Yeah.
And you hear the stories where I'm not going to be able to have sex in the way that I want to have sex
Well,
because
you
I'm on
just
blood
came out and
pressure.
said it.
Yeah, you say that. I mean, you want to talk about those things because you want to tell a man that uncontrolled blood pressure will mess that stuff up. And strokes and heart attacks would mess that stuff up. And so, you know, there's nothing that makes you kind of less sexually appealing than having your partner have to clean your bottom.
Oh, yeah.
And so you have that massive stroke, and now you're dependent on your partner to do the basic stuff like clean your bottom and feed you with a spoon and all that stuff.
Right.
Sex is totally different then.
Yeah.
And so it really communicating to men that, you know, we hear you. Now, I don't want to be a doctor to dismiss this because there are medicines that can affect people in kind of affect their sexual function.
Okay.
So we know that. We talk about it, but it's more common for the diseases that we're not treating, the diabetes, the blood pressure, to affect sexual function than the medicines we use, although it can happen. And so we want to be real. We want to talk to black men because we want to keep us around. We need to be around. If we're going to make differences, we need to be around. And if we're going to be around, we need the information.
That's true.
And we need that frank conversation. And I'd rather you ask me as a physician 1,000,000 times than go with what you heard that somebody else heard, that somebody else heard, that somebody else heard. You know, somebody said that lady down the street told me that it's going to mess with my nature. I'd rather you ask the physician than that lady
Ask the doc, right?
Because that lady down the street won't answer the phone when the bad stuff happens. And so, you know, just kind of going right in and just saying that, look, sexual function, we know that it's a concern, but treating blood pressure is very important. And that there are ways that we can work with you. There's things that there are other medicines out there. There's different strategies out there that we can address blood pressure and maintain, you know, and kind of have you have the sexual function that you want.
Yeah. Hey, man, look, fellas, with that, if y'all been tuning in, I know it's getting real good, man. Listen, we're going to take a quick break real quick. Hey, we're going to be right back.
You are now tuned into the Influ Game.
Ladies and gentlemen, welcome back to the Influ Game. Thank y'all for tuning in. Man, we took a quick break, but we're back. You hear me? And if you haven't been here for the first half, basically we touched on high blood pressure and strokes, which goes together. Yeah. Right. And these topics get heavy and in depth. So we're gonna toss it back off to Dr. Rayford one more again, and I guess he's gonna try to sum it up. And if y'all like this and what we got going on, matter of fact, if you know anybody that had a stroke or a cousin, uncle, niece, grandma, like share this with them as well. And man, leave y'all comments on y'all experiences, or But I know what I've seen ads and different commercials on like signs of a person that's having a stroke.
Perfect.
Yeah, I mean, I about to say. So when was you around when your
I was.
You were?
Yeah, and it was, I'm telling you, we didn't know what to do. You talking back when, I was in maybe one in the 20s, one in the 30s, and one a teenager. So we didn't know, and I'm anxious to hear what he's about to say to start recognizing those signs, because I can't get it off TV. A lot of things are streaming right now. So I that's why I'm so proud of this podcast. And we got the different age groups. Oh. I'm the youngest.
I like that.
That's right.
So if just in case, I'm gonna try to tie it together. So, Brother Hall, father and brother had a stroke.
Brother and sister
had a stroke before.
Yeah, brother had his first stroke at 28.
28.
Yes.
Okay.
And then one at 52.
Yeah.
My dad was 72. Now you see how, and my sister was, I think, 35. Now you see why I'm nervous about this.
Yeah. Okay, so we hitting that though.
Yeah,
that's
right.
Right. Hey, perfect. It's like perfect things. And let me tell you about some things in the community. There's going to be different things from the Coalition, Project Elect. We want barbers and hair professionals to come out on this Monday the 8th at the CDF building. We're really going to be at the Renaissance Center for Ideas on the 8th and the 22nd. So hair professionals, it's going to be during the noon hour, 11:45 to 1. Yeah. We're going to talk about high blood pressure. We're going to talk about stroke. And we're going to talk about how hair professionals can keep their customers alive and healthy so they keep coming back.
Hey, I like the way he knitted that deal.
A dead customer won't come back.
Okay.
You may get the final arrangement. Yeah. But that's it.
Oh man.
That's it. And so and it's really important, especially our hair professionals. They occupy one of the few places that all people from all walks of life still come. Yeah. And so us in healthcare engaging with the hair professionals, that's us making a step in the right direction together. And so we have evidence that when we help professionals meet the patients where they are, and we want to talk about Black men, if we meet them in the barbershop and we bring our interventions and we bring it through the barbershops, we can make some big differences. And so there's a really pivotal and powerful study showing that you can make a big difference in terms of like blood pressure and health promotion. But just getting back to stroke, so high blood pressure is a risk factor for stroke, diabetes, smoking, drinking, those things. But another big aspect of stroke, and I'm glad you brought this up, is another big aspect that can save a person who's having a stroke's life and reduce their chances of being fully dependent on others is early recognition.
Okay.
And so if you recognize and get people to care in the first 3 hours, from stroke symptoms to, if you can get them into care in the first 3 hours, there are interventions that we can do. And hospitals are now getting pressured at, or now working on being faster and faster to the point of, if the ambulance thinks that it's a stroke, they set some things into motion so that by the time the person get there, that medicine that can help dissolve a clot, that medicine is ready and waiting, and you can use that medicine. And that medicine could be the difference between walking in with a stroke and walking out, having had a stroke. And so one part is fast, early recognition. And so stroke is so common. Chances are you're going to be around somebody. If you're not a physician, chances are you're going to be around somebody and they're actually having a stroke. And many people have been around folks who wasn't right. And everybody recognized that they weren't right. They weren't talking right. They weren't acting right. They weren't looking right. Yeah. And then find out later on that they had a stroke. Yeah. Now, if you could rewind, what you do is, now this stuff has to be fast. And so if you're thinking about a stroke, and we'll have something that people can wear around the community to be like, look, if you're thinking of stroke, you need to be fast. Be fast. BEFAST, and each of those means something.
Hold on, before you do that, I know it was a while back when your family members had a stroke, right? You older now,
I'm
right?
older.
Even though Doc's going to give us the answers,
Right.
give me your educated guess. What you think the first thing you should do?
I think if I dial 911.
Okay.
I call for help. That's all. That's what I know to do. Call for help, and because I noticed them that they were just out unresponsive, but there was a pulse there. Now I'm not a doctor,
Yeah.
but I knew how to check for a pulse.
Yeah,
but
okay.
they're unresponsive in any other way. So something is going on. But my sister told me in her early stages that she could hear everything we were saying, but she couldn't.
She couldn't
say,
respond.
Right. Exactly.
Yeah.
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 Okay. All right, Doc. Go ahead. Dive in.
Yeah. So the T is time and call 911.
Okay.
So did I get it right?
Yeah. So the last part of that acronym is actually where you should start. And obviously, I think there's an opportunity for the community to also talk about what happens if somebody pass out right in front of you.
Yeah.
Well, you need to do what you can, call for help, and make sure that things are on the way. So certainly supporting that ability to call for help. If you suspect it's a stroke, call for help.
Yeah.
Now, what sort of things would make you suspect it's a stroke? B, somebody suddenly developed issues with balance. Somebody's walking and now they just pulling to the side.
Okay.
Sudden onset, trouble balance, sudden onset. They're talking about, I'm just suddenly dizzy. That could be a stroke.
Okay.
Call 911. E, your eyes don't look right. That eye's drooped. That could be a stroke. Call 911.
Okay.
And so it's one of those things that from a time standpoint, it's better to let us physicians figure it out on the back end. Don't wait until you confident. Many of us have that tendency of being like, well, if it don't get better in 6 hours, I'm gonna call Dr. Rayford. If it's a stroke, you have squandered that time, and now you're just at the mercy of what disability you're gonna be left with. And so in the first 3 hours, there's a good chance that you won't be left with any disability.
Oh, that's good.
If you wait. And so the other part about it is, there's some other therapies that can happen within the first 6 hours, but you got to be at a special place for that.
Okay.
So some of those therapies where they can go in through the vessels and try to pull the clot out, or squirt some of the clot busting medicines close to it and try to pull it out, you have to be in a special place. So our hospital can do those things.
Okay.
But if you're kind of further out, you kind of understand more time. Like if you're at the outskirts of kind of our area, so you're down in Eupora and you're in the country part of Eupora.
Oh, wow.
Then you got to get to, a place like Tupelo in the time. I mean, I'm going to tell you, you believe the ambulance and helicopters run all the time. Helicopters don't run when it's foggy. So if you having stroke symptoms on a foggy day, you're at the mercy of ground transport. So that's where time that if and I tell people, if stroke is anywhere in your mind and you say if this could be a stroke, call 911 and let the doctors figure it out. Let the doctors debate. It's always a 911. So B is balance. E is eyes, particularly a drooping eye.
Yeah.
F is face. When people say their mouth twisted, the face droops.
Okay.
A is arm. So arm weakness, sudden onset of arm weakness.
Okay.
S is difficulty talking. Somebody has a sudden onset of trouble talking. Could be a stroke. Call 911. And then T is time. Because when you're considering stroke, the clock starts ticking.
Wow.
When it enters, so as a person, it can be hard. Now, many people who go with stroke symptoms, it's probably not going to be a stroke. But always get it sorted out. Because if it is, you want to be where you can get the therapies that can decrease your chance of being, and stroke can change your life fundamentally.
Yeah.
You started the day walking and talking and interacting and able to do for yourself.
Yeah.
And you ended the day totally dependent on people for everything. You can't move on your own. You can't administer nutrition.
Yeah.
You can't clean yourself up if you use the bathroom.
Right.
Stroke can do that. Stroke can come around and be the death of independence. Wow. And some people who've had stroke wish they would have just gone on and died because the resulting state, I know everything that's going on, I can't affect it. You know everything that's going on, you can even say words, and then there's some kind of the strokes that affect how you communicate. Now there's some strokes that affect different parts of the brain that in your brain, you know exactly what you want to say. but stroke messed up that pathway
Wow.
from the I know what I want to say to the it's coming out of your mouth. And you know you're saying the wrong thing and you just getting frustrated. You can't say and then there's a way that it can be the reverse. Certain things come in and stroke can mess up how you interpret those things. Stroke can make you forget that you got a whole side. It can cause you to neglect it. It can cause me to not even believe that I got a right side. And so I'm always scraping and cutting and damaging my arm. It can cause what's called neglect.
Oh, listen, man. I see, man.
Serious
This is,
business.
man. This could turn. Stroke itself can turn into
Well,
a serious-
stroke itself can. I mean, stroke is, as we think about those things and I'll probably tie in mental health and is tied in with stroke, but mental health is worthy of his own time, his own topic. And, Velt, bring us back. Bring us back. We'll talk about it. But obviously, having a stroke and not being able to do what you could do can affect your mental health.
So I've heard of a couple people that had strokes and they look back normal, but it could have went. Obviously, they bounced back, or it could have went extremely left.
Could have stayed left.
Could have stayed left.
Could have stayed
And they
left.
came right. Oh man, this
Yeah,
is
could have stayed left. I mean, and then I didn't bring up something that's even a little bit more challenging is there's some people who have a short period of stroke symptoms where for 30 minutes to 2 hours where I'm having stroke symptoms and those symptoms resolve. And that person is at such a high risk for that multi-debilitating stroke that person needs to get help. Even if on the ambulance ride, thank the Lord, the symptoms resolve, because that person is about 3 to 6 months away from that big one. Okay. And so we call those things TIAs, transient ischemic attacks. And those are, you may hear people say mini strokes.
Yeah.
Sometimes it's a little challenging, but those are almost like stroke auditions.
Okay.
That's your stroke auditioning.
Yeah. Oh
Man.
And
For the
it's
big-
auditioning. And the only thing that didn't keep it as a stroke was the symptoms resolved. But those people are at such a high risk that we manage those people. We manage those people like we manage stroke.
Okay.
Is that our time?
Man, listen, I was trying to keep it around because we know we got Doc. Man, he got so many places to be in.
Hey,
People to
that
see.
just means I got to come back.
Oh yeah, most
I
definitely.
got one question for you though. So, and Doc has a tendency to undersell himself.
Oh okay.
What I'm saying is, on top of being a medical doctor, this man has accomplished being one of the top 10 influential blacks in Mississippi.
Oh, I ain't know that part.
The coalition against COVID, he's led that pretty much for our community and gave how many shots?
About 2,700.
27.
So he's made these partnerships and having a black doc in the area, and I just wanted to bring that out on your show. This is the man that we have. I mean, he could be making money somewhere doing this, but we have a black doc in our community that's willing to give his time.
Yeah. Hey, with that being said, I'm right now in the post production. I'm gonna put a round of applause.
He's going to put a round of applause.
Oh yeah, man. Listen, man.
Gonna put a laugh line in.
Oh yeah. Hey man, listen. If y'all enjoyed this and have gotten anything out of this, man, I want y'all to please like, comment, subscribe, tune in, share. You know what I'm saying? I think even though I think we had fun discussing this, but it's very important, and I think that's a real easy way to digest this information because it's a lot. So that's why we're gonna
Yeah.
So I slick want to call this like the PSA, like this is gonna be like the PSA of the format because it's even though we're discussing, but it's some nuggets and valuable information.
Oh, so you want the elevator pitch?
Oh yeah.
You want the elevator pitch?
Yeah,
So hey, you're finished elevator pitch. Hey, so May is High Blood Pressure, Stroke, and Mental Health Month.
Yeah.
All are really, really big, great topics to learn more. I encourage everybody to learn a little bit more this month. There's a lot of opportunities to look around to learn more. Big thing about blood pressure is knowing your numbers and understanding what they mean. Big thing about stroke is if you can prevent it, do the work. If you can't prevent it, recognize it early and let us get you the therapies that can help you survive it and to keep from being as disabled as if you didn't. And then for mental health, this is a really, really big topic. It's okay to not be okay, that mental health is a significant issue, and people who are unhealthy from a mental health standpoint are unhealthy from a physical health standpoint. And so if you want to see a vulnerable population, people who are as affected mental health are having strokes, are having heart attacks, are living a whole lot less than folks who aren't. And so getting all of those aspects managed, they all work together.
Yeah.
Yo, what's going on? It's your girl K.LA, and you are now tuned in to Influ Game.
Appreciate you being here. Then we got Brother Hall here, man. I'm trying to tell you, man, these cool kids, man. I'm just.
Well, we look forward to coming back, and you know, as Belt's gonna tell folks how to join, and Robert can share it with his fan club.
Yeah. Hey, people. With that being said, man, it's been another issue, another episode of Influ Game. We over and out. Thank y'all for tuning in.
Thank you. Appreciate it.
Cut.
You are now tuned into the Influ Game.
Oh yeah, smile, fool. You look too good to be fried. Now, why?